Hello friends, I am Dr. Harsh Mathur from Om Netralay, Varanasi, India. This video contains an operative procedure meant for eye surgeons for education purposes. Viewer discretion is strongly recommended, not meant for children. So in this case, we'll learn how to do a trench first and then chop the nucleus. It is an easy way to divide a nucleus, especially for beginner surgeons. So a bit of HPMC is put over the cornea for better visibility. Now, the basic aim of a phaco surgery is to divide the nucleus into desired quadrants depending upon the density of the nucleus. So there are various ways. You can use a pre-chopper, divide and conquer, stop and chop, or direct chop. So one can directly go and do a direct chop, or first we can make a small trench that will give us a good idea of the depth needed to go and hold the nucleus firmly, and then chop the nucleus. So by now the capsule has been stained, the main incision is constructed, and two paracenteses have been made. A 5.5 mm marker is used, which helps to guide the rexus irrespective of the dilatation of the pupil. So with a 26 gauge bent needle, a flap is created, and just following the contour of the flap, we are able to get a 5.5 mm fairly round rexus. A good hydro dissection is important to free the nucleus. And the nucleus rotates easily. So it's a grade 3 plus nucleus, a good density to learn direct chop. The bevel is turned up, just going at the proximal end. A small trench is created. Now going to the chop mode, and the nucleus is held firmly and we get a good crack. Rotating the nucleus, and now we have two heminuclei. Hold the heminuclei, chop it, and the same is done to the other heminucleus. So now we have four pie-shaped quadrants which can be then easily emulsified. A triangle is formed between the chopper and the probe, which keeps the nuclear fragments at bay and prevent them from going up and hitting the endothelium. So in no time we are able to emulsify the four quadrants. Now is the time to clean the cortex. So I am using a 22 gauge Simcoe cannula, and the cortex is cleaned up in no time. Always use the side ports. Clean the 12 o'clock subincisional cortex, gives better chamber stability and a good access to all the fibers. Now is the time to implant the IOL. Wound assisted IOL implantation is being done, and in this case a hydrophobic intraocular lens is implanted. The leading haptic goes in the bag, and then the trailing haptic is gently dialed in. Now is the time to thoroughly wash the anterior chamber. Go behind the IOL, clean up all the HPMC. So the take home message is, we need to divide the nucleus into 2 halves, 4, 6, 8, depending on the density of the nucleus. Whichever method suits you, which is best for the patient, best in your hands, one should do it. For beginner surgeons who want to start direct chop, learn direct chop, then this would be a easy way. So make a trench proximal to the subincisional anterior capsule, the rim, and then make a small trench, and then once you get a good depth, just hold the nucleus and chop it. That's it. Thanks for watching.